Assalamualaikum once again, everyone. This is topic number 3, uh, patient care equipment and instrument. Okay, learning outcomes. Describe the role of equipment or instruments and devices contamination in transmission of microorganisms. Um, Next one is explain the difference between decontaminating invasive and non-invasive equipment, instruments, and devices. Number 3, explain the terms single-use and single-patient use. Explain cleaning, disinfection, high-level disinfection, and sterilization. And explain the implications of damaged equipment, instruments, devices for adequate decontamination. And last one is demonstrate the correct method to decontaminate equipment relevant to the role. All right. So you'll be hearing a lot of terminology of decontamination in this lecture and forward. And, for decontamination, what it actually means is it contains cleaning, disinfection, and sterilization too. But some of the books or references that you will find out decontamination doesn't necessarily has sterilization part of it. It's just cleaning and disinfection, right? All right. These are the types of this cleaning, disinfection, and sterilization processes that we have covered in the previous lecture. So you can see the cleaning manual and automatic cleaning, disinfection, low level, intermediate level, and high level. There is also thermal. And then for the sterilization, there is a high temperature, low temp, chemical, gas, and radiation. So this is just a review for you guys to have a look. All right, so let's look at this statistics that have been done by Esfahani in 2017. They actually collected um, the bacterial count of the units, in dental units or dental chairs and the cupboards, before and after disinfection based on the department, which is the clinical specialty, which is oral and maxillofacial surgery, perio, prosto, orthodontic, pediatric, restorative, OM, endodontics, and endodontics. Okay. Um, you can see the difference between before and after. So oral surgery has always been the most risky because they are surgical based, so they have involved a lot of blood contamination. So you can see not much of difference of in terms of bacterial contamination. So it's a bit difficult. So they have to improve in terms of the decontamination of the area. Okay. Also, perio does not have changes. Um, and for prosto, it actually increases. Same thing with orthodontics. For pediatric, it's lower, which is quite effective. Restorative also higher. Oral medicine lower. Endodontics is the same, whereas in total, um, slightly change in terms of the bacterial contamination of the units. So these are not a good numbers. So we need to work hard to ensure the decontamination process of our unit is excellent. Okay, so this just to give you an uh, overview of what's going on now. So this is very much relevant to all of us. So we need to aware that decontamination process is very, very important for us to do. All right. Looking at the contamination risk. So there are three types of risk, which is low, medium, and high. For low, the it belongs to actually equipment in contact with healthy skin. Okay, there's no trauma on the skin. Um, for example, if we touch the furniture, office equipment, mattresses, surfaces, commodes, wash bowls, hoists, and etc. Whereas for the medium, is equipment in contact with any intact mucous membranes or, for example, respiratory equipment, equipment contaminated with virulent or readily transmissible organism, and equipment for use with immunocompromised patients. Whereas the high risk equipment in contact with broken skin or mucous membranes, for example, surgical instruments, indwelling devices, intrauterine devices. Okay, for dentistry, we deal with a lot of high risk equipment, especially for oral surgery. So if you look at the minimum standard suggested for every risk, you can see for the minimum standard of the low, cleaning is usually adequate. Appropriate cleaning method should be followed either through manufacturer's recommendations or the following one you can find in our references. Cleaning and disinfection or sterilization for the medium risk. Okay, and sometimes we can use single use item whenever possible, whereas for the high risk we have to use a single use sterile equipment as much as possible. There are sterile equipment that we can't use, for example, we can't use as a single use. For example, the metal instruments, okay, is not economically fit for us to use once only. So some of the disposable item, most of the disposable items are single use. So you need to use single use item for whenever possible for the high risk contamination. Let's look at this Spalding classification system, a person who classify the devices according to three classifications. This one I have discussed with you earlier, which is the critical device, semi-critical, and non-critical. So it's almost the same definition with what we have discussed before, and it shows you the level of reprocessing. We'll talk about the reprocessing later. So for the critical device, the example are surgical and biopsy instruments, yes, very much related to dentistry. Semi-critical device, dental mirrors, because it contact with the skin or the mucous membrane, which is the mouth, right? But it doesn't penetrate the mucous membranes, okay? And then for the non-critical device, the device that only come in contact with skin but not mucous membrane, for example, the oximeters, ECG machines, blood pressure cuff. So that one has a minimal cleaning technique or method for that, okay? All right, let's look at the difference between single use, single patient use, and a single use. So these are not the same. Okay, so for single patient use means the medical device may be used for more than one episode of use on one patient only. So the device may undergo some form of reprocessing between each use. Okay, but you can't use in other patients. All right. For the single use device, as you can see the symbol up there, is used, this is a symbol, right? Is used on the individual patient during a single procedure and then discarded. It is not intended to be reprocessed and used again, even on the same patient. For example, the needles that we take blood, okay, the syringe that we take blood, we cannot use more than once, all right? So that is a single use item. All right, before we go further, just gonna show you this is how we treat our um, instruments, okay? And this diagram are showing you the zones that we have created based on the types of the dirtiness or the soiled instruments. Okay, so if you look at the red one is the soil zone. So when the dirty instrument arrive at the central sterilization and supply unit, okay, they will go straight away to the soil zone, which is what we call another name, dirty zone. Okay, so for the dirty zone, the staff who are working there will have separate PPEs from other zones, isolated from other zones, and they do actually have a different air circulation. Okay, so you can see in between soil and clean zone there is a barrier, so you cannot just walk into the clean zone when they are cleaning. Okay, so the people who are working in the soil zone will stay in the soil zone. If they want to move to the clean zone, they have to change the attire. All right, so what is in the barrier between soil zone and clean zone? It's actually a washer, a mechanical washer that we use to wash our instruments. Okay, so when it's being washed, it can enter clean zone. So the equipment, the staff who are there are wearing a different PPE than the soil zone. So they are actually receiving clean items but not sterile items. So from soil zone, they will go to the clean zone through a barrier, and usually the barrier has the machine, which I will show you the photo later on. Okay, so what happened in clean zone is they will inspect and they will package the instrument and make it ready for the sterilization. Okay, so where is this sterilization? Is actually in the barrier here. So from the clean zone, the instrument will enter the sterile zone through a barrier. Normally, we put it autoclaves. So they will go through the autoclaves, and staff in the sterile zone with different PPE will take from autoclave and store in the sterile zone. So I will show you about this later in the photos, okay, so that you don't confuse. So this is just to show you about the CSSU. So we have another topic for just for the CSSU alone, or what we call sterilization room. So for this CSSU, you normally see in the hospital and in the dental faculty. You don't see this in the clinic because the clinic only have sterilization room, small clinic. Okay, for the hospital they do have this. All right. Excuse me. This is again to show you in a 3D photo where we talk about the red zone, the blue zone, and the green zone. So this is where they disinfect and clean, and then they package and then they sterile through this wall. And once it's done, they will receive on the other side on the green zone, and they will keep it there. Okay. So in our dental faculty, UITM, we have this sort of setup downstairs. Okay. All right, so let's look at this. What I've been talking about with the CSSU, they actually following this cycle of reprocessing, instrument reprocessing. Why it's called reprocessing? Because it being processed again and again, because this is not a single use item, right? So when the instrument being used on your left here, and once done, they will be transported to the CSSU or any sterilization room for cleaning. After the cleaning, they will go for disinfection. After disinfection, they will go for inspection, which I will explain later about this. And then after the inspection of any damaged items, and only good item will pass through and will be packaged. After the packaging, they will sterile, and after sterile will be transported again to the storage room, okay, the green zone, the sterile room, okay, and then will be used again in the clinics. All right, that is the instrument reprocessing cycle. We will see this in a little bit more details. So as for instrument reprocessing, when used on patient, reusable devices, which is the metal devices, normally become soil and contaminated with microorganisms. So to avoid any risk of infection by a contaminated device, reusable devices undergo reprocessing, which is a detailed multi-step process to clean and then disinfect or sterilize them. Okay, so look at the boxes here. You can see the first one is cleaning. Clean underwater with non-abrasive neutral pH detergent, which is happening in the clinic. In the smaller clinic, they call it sterilization room. So they use this cleaning method. Okay. After cleaning, they will use disinfection. Use appropriate disinfectant for instrument prior to inspection. So what is inspection actually? Okay, for inspection, we inspect if after the cleaning, if the instrument has been properly cleaned, absence of corrosive substance, free motion of hinge, if the instrument can move around, so you make sure that the instrument is not damaged, can move around, can function normally, and then the sharpness of burrs or gauge are there, not being damaged, so that they are inspecting for any damage or missing items or missing parts that may be not functioning when being used later, so they will not package if it is damaged. Okay, so that is the inspection process. After the inspection, they will package. So item must be packaged in a manner that maintains their sterility. So there is many types of packaging. We as a dentist not going to do this. Our assistant will do that for us. So they have to learn how to do a packaging of the materials. So you can read about the details later on. And then after the packaging, they will put in the autoclave for sterilization. So the methods of sterilization that we have learned will be used over here. Okay, so all sterilization methods require meticulous training. So any staff who are going to use autoclave, they will need to go undergo a little bit of training. Okay, and after that, after the sterilization, the sterile item will be stored. All right, so that is about the instrument reprocessing. Okay, let's look at this video about dental instrument decontamination.
Peace up, A-Town down. Yeah, yeah. Okay.
In this video today, we are going to demonstrate how to properly pre-clean and sterilize dental instruments. The sterilization assistant should wear the appropriate personal protective equipment at all times. Once finished with patient procedure, put contaminated instruments in cassette and wrap with the sterilization wrap. Transport contaminated instruments to sterilization. To pre-clean instruments, we will use the CMA dishwasher. Insert the overflow tube in the seat inside the wash tank. Load the cassettes in the rack. Close the washer door. Turn on the washer by pressing the on-off push cycle. Wait for the water to fill up. When water level is complete, press the cycle start push button. When the cycle is complete, open the door and remove the cassettes. The washer is now ready for a new wash cycle. At the end of the clinic station, turn the on-off push button. Remove the overflow tube. Press Press the drain pump push button until all the water has completely emptied from the wash tank. A gargling sound will be heard when water is completely drained. At the end of the day, remove filter and clean with brush under running water.
Replace your filter.
Dry instruments thoroughly. Take them out of the cassette. Make sure none are broken. Place sterilization strips in cassette. Place instruments to be wrapped for autoclave.
Make sure all sides of the cassette are covered.
Next, you will use a chemical indicator tape. Be sure to indicate between the masking tape and the chemical indicator tape. The chemical indicator tape is the one with the stripes. Take a marker from the dirty container and put your initials, the date, and your locker number. Cassettes are now ready to go in the autoclave. Load autoclave, do not overload. Turn on power control and choose pack setting. Check water level and reservoir. Fluid should be approximately 1 inch from the drain tube opening. Add distilled water if needed. If screen indicates too much water, you should remove the tube and drain. Insert load tray, close and fasten door. Press the start button. Monitor unit for proper function. Before opening a door, don heat-resistant gloves. Open door when cycle is complete. Dry ready lights are flashing and unit beats 5 times. Leave door crack until drying cycle ends. Ready light is flashing and unit beats 5 times. Instruments are now ready to be removed from the autoclave and stored. Turn off power at the end of the day. For handpieces and burrs, you would use the Lisa. Turn on the Lisa. Load packs and bags loosely into shelves inside chamber. Fill water reservoir until beep sound indicates full. If directed by the screen, empty wastewater contents with drainage hose. Plug into the gray connector. Close door and follow touchscreen prompts to select cycle. For instruments and handpiece, select the higher temperature cycle. Continue with prompts to start the cycle. When the cycle is ended, use the touchscreen to release the door and put the machine on standby. Allow the contents to cool slightly before putting it away. Turn off power at the end of the day. To operate this datum, make sure packs are arranged loosely, paper side up. Place the top of the datum, close the lid until you hear a slight snap. Hold the cassette handle in one hand and the cassette in the other. Load the cassette into the datum until you hear a slight click. Gently push the cassette until you hear it click. Check the water reservoir for adequate distilled water level. Check the waste bottle for adequate fluid levels. Select the appropriate cycle. Select the right cycle. Press start. The sterilization cycle ends when the reminder tone sounds. The amber light flashes. Cycle complete is displayed.
If screen indicates there is too much water, this is the tube you would use to drain the excess water.
Peace up, A-Town down.
Okay, so that's done. So the video earlier showing you the sterilization, cleaning sterilization in the smaller dental clinic. Okay, and that's done in our in the private clinics mostly, but in a bigger facility they will have the central sterilization and supply unit as I mentioned earlier. And the photo that I'm showing you right now is in the UITM dental faculty um, central sterilization and supply unit. So now we are looking at the red zones, which is the cleaning process or procedure being carried out. So you can see the staff are cleaning the instrument with the appropriate attire, PPE, and also the brushes here for manual cleaning. And then you can see here they will send the instrument after that manual. They actually will put inside this washer, which gonna wash the instrument or equipment automatically. And after that, it will go through the next zone, which is the blue zone, which is the inspection and packaging will happen. Okay. Now we're gonna go to the blue zone, which is the packing. So now the staff are packing. After you see, this is the washer that you see from this side. And once they take out all the instrument from there, they will do inspection. After the inspection, they will actually package the whole items for the instrumentation, for the sterilization. And now, after the packaging, they are ready to sterilize using the autoclaves. So you can see the autoclaves here. So they will push everything in, then they will press the start button. And then after the sterilization done, they will store. So all these are the sterile item being stored appropriately in every category based on the categories. All right, so let's talk about the environmental surfaces. What we're talking about here is the surface that is available in the clinic. For example, the tabletop, the dental chair surface. Okay, so according to the WHO, environmental surfaces divided into two, which is housekeeping surfaces and medical equipment surfaces, or we call it as clinical contact surfaces. All right, so as just an overview for the surfaces in the dental practice, we are at the higher risk because it can easily be found a lot of bacteria or microorganisms. I can see the statistics here. The types of microorganism can be found in the on the surface of the dental clinic. Okay, just to give you some rough ideas when we talk about surfaces in the dental practice. All right, so just showing you with the red rings there where the surfaces that we normally touch with our hands. Okay, so first of all, the light switches, the stools. This is the operated stool, assistant stool, the dental chair itself, the carriage, the lights, computer, the bench, right, and the X-ray machine. And this is the button for the X-ray machine. So all these are the one the common that we use. I forgot to mention about the sink as well. Okay, so all these are the clinical surfaces that can be decontaminated after each patient or after each use. So these are the examples, the names of clinical contact surfaces in the dental office: airway water sharing handles, hoses, bracket tray, chair control buttons, chairside computers, countertops, dental team chairs, the handles on the backs, dental chair, dental radiology equipment I showed you before, doorknobs, drawer handles, evacuator controls, evacuator hoses, faucets, handpieces, headrests, intercom if we have, like your handle, mobile cards, pencils, whatever it is, and including telephones. So all these are um, present with a high risk of contamination. So you need to decontaminate all these items, okay? So once our preventive measures is to put the barriers. So we call it barriers. You can see on the bottom one here is what we call film barriers. So we can actually wrap up all the possible contact areas with this film barrier so that it will not decontaminate our surfaces. Okay, so we can actually do this, but normally in the clinic we do not do this barriers all over the dental unit, just the headrest. Okay, just the headrest most of the time. Okay, so there are advantages of putting the barriers, as I mentioned you earlier, or not putting the barriers. If we are not putting the barriers, we need to clean and disinfect. If we're putting barriers, normally we don't do the disinfection. Okay, for the surface barriers, advantages to prevent contamination and cross-contamination, protect surfaces that are difficult to clean or maybe less time consuming to perform, reduces use and handling of disinfecting chemicals. So sometimes some of our equipment, if we use disinfectant a lot and all over most of the time, it will damage the surface. So by using the surface barrier, it may not damage the surface. Okay, so you can read on your own about the advantages and disadvantages of having the barriers and not having the barriers. If not having the barriers, we need to do cleaning and disinfection. Okay, all right, I think that's all for this topic. Thank you.